Hi, this is Menace Joannides. This is the Optimum Academy, Diabetes 101, video number 3, treatments for diabetes. So let's get started. So treatment for diabetes type 1 requires insulin injections via needle or insulin pump because all insulin must come from the outside of the body. The pancreas is not making any insulin. That's the problem in diabetes type 1. So close monitoring of glucose levels to control the A1C levels are needed so that the blood sugar never goes too low to cause hypoglycemia or low blood sugar, and we want to make sure the blood sugars don't go too high. So not only do people get insulin if they have type 1 diabetes, but they also should be on some kind of dietary control and getting the required exercise they need to keep fit. And they need to control all their other risk factors like high blood pressure, kidney disease, so they may be on blood pressure medications or medications to protect the kidneys, like ACE inhibitors or what's called ARBs, or they may be on statins to control their lipid levels if the lipids have been high. They also need regular checkups by a skilled healthcare professional to monitor for complications, because you want to avoid all of those. So they should be checked for cardiovascular disease to make sure they're not at risk for CAD, coronary artery disease. They haven't had an MI or have the risk factors for an MI, or they're not going into heart failure. They also should be checked for their kidney function, hopefully to prevent diabetic nephropathy or any evidence of kidney failure. They should have their eyes checked regularly to screen for retinopathy, and if they have any nerve problems, that's called diabetic neuropathy. So what are the underwriting factors for type 1 diabetes? So you want to know the current age and the age of diagnosis of the diabetes. The longer the duration of diabetes, the higher the risk. You want to know the quality of the A1C control over time, hopefully without any episodes of hypoglycemia. And you want to make sure that they haven't had any episodes of ketoacidosis that require treatment in an emergency room or a hospital. Those can be dangerous. And as we talked about, you want to make sure that their other risk factors are controlled in case they have high blood pressure or elevated lipids or things like that. And then when we're reviewing a case application and the person has type 1 diabetes, we want to make sure that they don't have an abnormal EKG, so no history of coronary artery disease or an MI in the past. Elevated blood creatinine or protein in the urine is checked for, and then if they have any abnormal eye exam findings, like examples would be diabetic retinopathy. Treatment for type 2 diabetes, the person should be on a diabetic diet with calorie control, portion control, and hopefully eating low glycemic food so there's no glucose spikes. They should be getting appropriate exercise and aim for ideal body weight, and try to keep their A1C below 7 if possible. Medications that are used, typically metformin is a first-line drug. It's inexpensive. It's an oral medication, and many diabetics are started on that drug. Other newer drugs that are being used in the treatment of type 2 diabetes would be GLP-1 drugs like Ozempic or Mounjaro. Not only do these drugs lower the blood sugar, but they also can contribute to improved weight loss, which may be very useful if somebody is overweight and has insulin resistance due to that factor. Other drugs, the SGLT2 inhibitors like Farxiga, Jardiance, or Invokana. And what these do is they eliminate glucose in the urine. So the kidneys actually dump sugar from the bloodstream into the urine so that the urine glucose is high on the labs that we get. So you'll note that if you get a urine sample with the requirements for the application, the urine glucose is usually very high, and that's because that's how these drugs work. They actually dump sugar into the urine to eliminate it from the body, and that helps lower the sugar levels. There's other class of drugs called DPP4 inhibitors you may have heard of, like Januvia or Tradjenta. And then in the past, we used to use a lot of sulfonylureas like Gucotrol, Micronase, Diabeta, etc. So you may still see some of those, but many people are on these newer medications for diabetes type 2. Glucagon-like peptide. So that's what GLP-1 stands for. And in the body, there's a glucagon-like peptide, which is a natural occurring 30 to 31 amino acid long peptide. It's a hormone produced by the body that increases the amount of insulin that's produced after a meal. So what drug companies were able to do is to find a drug that simulates the GLP-1 activity that's normally produced in the body and hopefully increase the effectiveness of that hormone by having more of this available after injection. So the word agonist, which is what these drugs are called, means a medicine that needs to bind something in the body to have an effect. In this case, it has to mimic or copy the GLP-1 that's naturally produced in the body. So a GLP-1 receptor agonist causes the body to release more insulin, which may help control the amount of sugar in the blood in type 2 diabetes. So it's only used in type 2 diabetes, not type 1. GLP-1 receptor agonists, which are these drugs, also help to increase satiety, which means a fullness after eating, so they don't eat as much food, and hopefully that contributes to the weight loss. So get dual benefits. So are these GLP-1 drugs magic? Not only are they used in the treatment of type 2 diabetes to help with control of blood sugar, but they have attributes such as body weight loss. However, it's been found that they have other appealing qualities like reducing neuroinflammation. So they promote nerve growth. They also seem to help with improving heart function. They suppress the appetite for weight loss because they delay gastric emptying. And they also can help regulate blood lipid metabolism and reducing fat deposition. So they have a lot of favorable effects. As a matter of fact, they have so many favorable effects, maybe we should consider giving credits in underwriting if people have had significant weight loss, are continuing to use these drugs, and are having favorable factors noted because of the use of these drugs. So naturally, it should be combined with prudent diet and exercise, as all type 2 diabetic patients should continue with. Are they too good to be true? Are these drugs seem to be too good to be true? Well, watch out for fake drugs. People may make or compound these drugs and try to sell them as the originals. There may be all kinds of scams, diversion of drugs to the wealthy who can pay cash. So there probably is going to be a lot of bad press about GLP-1 drugs. As you can imagine, anyone who's in the business of trying to promote weight loss with exercise or new diet regimens doesn't like the competition from GLP-1 type drugs, which seem to work excellently in helping with weight loss. So they may have direct and indirect effects on the heart and blood vessels, and these effects are cardioprotective. So they improve a lot of the things we are concerned about when somebody is at risk for heart disease. Studies are still continuing that may show that the mechanism involves more than just blood glucose control, but something else is going on that provides these favorable qualities. And GLP-1 drugs have also exhibited lower all-cause mortality, as well as hemoglobin A1C reduction in patients with type 2 diabetes. So what's not to love, right? They appear to have favorable effects on the heart, the brain, the liver, the pancreas, and the GI tract. So a lot of great qualities from this new class of drugs that are basically based on the body's own glucagon-like peptide 1. Here's just a graphic to show you what drugs are available and how they are administered. So Ozempic is basically for type 2 diabetes, but people are also using it for weight loss, and it's an injectable drug into the subcutaneous tissue. Rybelsus is the same drug, semaglutide, but it's an oral pill. Obviously, it doesn't have as large an effect as the injection, but it is also used for type 2 diabetes and may have some accompanying weight loss, but probably not as significant as the injected drug Ozempic. Wegovy is also injectable. It's the same exact drug as Ozempic and Rybelsus, and it's being marketed for weight loss and is given in larger doses. But basically, all three drugs do the same thing. Whether you market it for diabetes or you market it for weight loss, it's the same exact drug. At the bottom, I've circled Mounjaro, which is tirzepatide, and tirzepatide is kind of a combo drug, which is also injected, and it is specifically for type 2 diabetes, but it is also now being marketed as Zepbound for weight loss. And Mounjaro and Zepbound are exactly the same drug as well. So all these drugs are marketed in a pen form, so you actually have to carefully read the instructions, and you inject into the subcutaneous tissue. It's basically a painless injection once a week. But as I said, you have to follow the instructions very carefully because the doses change over time depending on what your healthcare professional has prescribed for you. So it's very important to follow the directions exactly and not share pens with family members or anyone else. They're specifically designed for the patient's use who it was prescribed for. There's the other class of drugs that I mentioned, the SGLT2 inhibitors. Are they magic? They're also used in diabetes control, but there may be weight loss because they're releasing glucose into the urine. So elevated glucose levels in the body are dumped into the urine to get rid of the sugars. So this class of drugs may lead to weight loss, improved blood sugar control. These are called Invokana, Farxiga, Jardiance. However, they also may have cardioprotective effects and are now being used in early congestive heart failure. So it's amazing that a drug that just dumps sugar into the urine to get rid of it from the body may also have a cardioprotective effect and has become part of the regimen in early congestive heart failure. So what are the underwriting factors in type 2 diabetes? Obviously, if somebody is overweight, we consider that as a risk factor. The quality of their A1C control over time. Have they basically normalized their A1C, or are they still running very high levels? We want to take a look at all their other risk factors like elevated blood pressure, lipids. Do they have obstructive sleep apnea due to the build, things like that? And then any complications. Have they had an abnormal EKG, history of a cardiovascular disease, coronary artery disease, or an MI, which may be silent without the usual pain in diabetes? We check their blood for creatinine levels. Elevated creatinine levels would be a concern, or elevated protein in the urine or albumin in the urine might be a harbinger of diabetic nephropathy. They may have an abnormal eye exam, so that needs to be checked for regularly to ensure they don't have diabetic retinopathy. And then if they have any nerve problems, we call that diabetic neuropathy. So that completes this video on diabetes.